Hello again, dear students. In this video I'm going to talk about the muscles of the lower limb. Muscles of the lower limb we divided to the following groups. The muscles of the hip joint, we divide them to the ventral and the posterior group. The posterior group is subdivided to superficial layer and deep layer. Then the muscles of the thigh or femoral region, that we divide them to the anterior group, then the medial group or adductor groups, and finally the posterior group. Then the muscles of the leg or crural region, we divide them to three main groups: the anterior group, the lateral group, and the posterior group. This posterior group again is subdivided to the superficial and deep group, and finally the muscles of the foot, that we divide them, the muscles of the foot, to the muscles of the dorsum of the foot, and the muscles of the plantar region, that is subdivided the muscles of the toes, the muscles of the small finger, and the muscles that they are located at the midline. We are going to discuss the details of each groups. Here there are the muscles of the ventral group of the hip joint. We have three muscles in this group. First muscle is iliacus. Second muscle is this muscle which is called psoas major. And the next muscle, which is here, I catch it with the pincet, is psoas minor, that in 40% approximately can be missing. This group, they are the muscles that they have general function as flexors. It means that they are doing flexion at the hip joint, and some rotational movement that I'm going to talk. So first muscle is iliacus. Iliacus is this muscle, is originated at the iliac fossa, if you remember, at the pelvic surface of the ilium. We had the fossa, which is called iliac fossa, and here is the place for the origin of the iliacus muscle, inserting to the lesser trochanter of the femur. And this muscle is innervated by the function, as we said, is flexion and some rotational movement, mainly the external rotation at the hip joint. And innervation is innervated by this nerve, very nice, is seen, is a femoral nerve. Next muscle is this muscle which is called psoas major. The psoas major is originated from the body and the costal process of the vertebra L1 till L4. The insertion is again the same, the lesser trochanter of the femur, and the function is flexion and rotational movement, mainly the external rotation of at the hip joint, and by bilateral contraction of this muscle or bilateral action, both side action, it can cause or form or make the flexion at the vertebral column at the lumbar region. The psoas major is receiving the innervation from the plexus, which is called lumbar plexus, directly. It means that directly from this plexus, that we will discuss it in the nervous system, the nerves that they are innervating directly the psoas major from the lumbar plexus. Next muscle that you can see here, that I cut it, the tendon, is this small muscle which is called psoas minor, and is, as we said, that in 40% it can be missing, 40% of the case, and is starting from the body of the vertebra of T12 and L1, and it's continue and is inserted usually at the iliopubic eminence, or sometimes it's called iliopectineal eminence here, and the function and innervation the same as psoas major, which is flexion and external rotation, and innervation directly from the lumbar plexus. Here you can see very nice the nerve, which is called femoral nerve, is relatively a thick nerve, and if you want to find the femoral nerve at the dissection, at the preparation in the cadaver, so always the femoral nerve is located between the iliacus muscle and psoas major. There is a fissure that there is a typical place for the finding of the femoral nerve. Another important, as you see here, there are the vessels, the vein and the artery, that they are external iliac artery, that they are going under the inguinal ligament, and they continue as a femoral vein and femoral artery that we said that they are passing through the vascular compartment under the inguinal ligament at the medial side. And iliacus muscle and the psoas major together, they joint together and they go under the inguinal ligament in this region, and they form one muscle which is called iliopsoas, and the name is changing exactly when it passing, they joining together these two muscles, and they passing under the inguinal ligament at the muscular compartment, and they form the iliopsoas that in next preparation I'm going to show you is better, together with this femoral nerve that is passing through the muscular compartment as well. Here, as we mentioned it before, those are the muscles of the abdomen, and here is the aponeurosis, this whitish thick band of the connective tissue, that is aponeurosis of the external oblique abdominis muscle, that is forming the inguinal ligament here, and which is starting from the anterior superior iliac spine and is inserted to the pubic tubercle, and it's continuous lacunar ligament. We said that is not a true ligament, is a continuation of the aponeurosis of the mainly the external oblique abdominis muscle, that in the next preparation I'm going to show it to. Here is another preparation regarding the inguinal ligament. As I said, this is the inguinal ligament that is originated from anterior superior iliac spine, it going to the pubic tubercle. Under the inguinal ligament, we had two compartments, the muscular compartment, very nice, you can see this muscle which is called now iliopsoas because it's passing under the inguinal ligament, but above that it was consist of the iliacus muscle and psoas major. Together in this compartment, the muscular compartment, it's passing the femoral nerve. This is the muscular compartment, and the medial compartment is vascular compartment, that from the medial side, the most medial side in this region usually is the lymph node, inguinal lymph node, deep inguinal lymph node, and then is the femoral vein, and then the femoral artery. That's why it's called vascular compartment, and between them is the iliopectineal arch that is separating these two compartments from each other. So what I wanted to show you here is the passage of the iliopsoas muscle that above the inguinal ligament. If I turn it and I fix it, here you can see the psoas major muscle here and the iliacus muscle here, that they are fusing and joining together here, and then they make the this muscle which is called psoas, the iliopsoas muscle. Here we have the posterior, the muscles of the posterior compartment of the hip joint. We divide those muscles to two groups, the superficial group and the deep group. The superficial group, the largest muscle that you can see here is the gluteus maximus, this muscle. It's a very large muscle and thick muscle. The gluteus maximus, it has different origin. It's originated from the iliac, from the outer surface of the hip bone, from the iliac crest, and from the posterior gluteal line that, if you remember, we discussed it at the bone section, and also is originated from the lateral margin of the sacrum and lateral margin of the coccyx, and some small origin from the sacrotuberal ligament. This is the origin of the muscle. So the insertion of the muscle, it's inserted, if you remember, we have the gluteal tuberosity, that in some case it's so big that they call third trochanter sometimes also at the femur, and also is inserted to the very thick connective tissue that I'm going to discuss. Is called iliotibial tract, and this is the insertion. So the gluteal tuberosity and the iliotibial tract is the typical insertion of the gluteus maximus. Since it has different different origin, so also this muscle it have different function. The main function of whole this group, the posterior group, is extension. It's the antagonist of the anterior group that they were doing the flexion. So here is the extensor's muscle. So main function is the extension and the external rotation at the hip joint. The superior part of this muscle, it's inserted to the iliotibial tract. It's making some abduction at the femoral region. The inferior part of this muscle, it's making the adduction of the femoral region. And also, since it has the insertion to the iliotibial tract, it's helping the extension at the knee joint. The innervation of this muscle is by inferior gluteal nerve. If I open the gluteus maximus here and I fix it, then deep to the gluteus maximus we have another muscle here, you can see. It's the gluteus medius muscle. Gluteus medius muscle, it's also originated from the outer surface of the ilium. It means that precisely at the anterior gluteal line, and is inserting to the major trochanter or greater trochanter of the femur, and also it has different part. The middle part, it's making abduction. The anterior part, it's making the flexion and the internal rotation, and the posterior part, it's making the extension and outer or external rotation. This is the function of the gluteus medius. The gluteus medius muscle is innervated by superior gluteal nerve. Another muscle, gluteal muscle, which is deep to the gluteus medius, is located, and some part of this muscle, you can see it here, it will be here, is called gluteus minimus. The gluteus minimus originated from the inferior gluteal line, again at the outer surface of the iliac bone, and is inserted to the greater trochanter of the femur, and more or less the innervation and function is the same as the gluteus medius. It means that all the function that we said, and the innervation is the superior gluteal nerve. Another muscle also existing in the at this region, which is called the tensor fasciae latae. Tensor fasciae latae muscle is here, that it's not well dissected here. I'm going to show you in the next preparation that here is started at the anterior superior iliac spine and is inserted to the very thick connective tissue continuation of the fascia of the femoral region, which is called fascia latae, and laterally it's becoming very thick, this fascia, which is called tractus iliotibialis, that in a while I'm going to discuss about this for in better preparation. So here was the superficial muscle, and when we dissect the superficial muscle, then we have the deep group. The deep group of muscle generally is called, they are called pelvic trochanteric muscles. The pelvic trochanteric muscles, they are forming by these muscles that I'm going to show you. This is the piriformis muscle here. Then you have the gemellus or gemellus superior, superior gemellus or superior gemellus muscle is this one. Then you have, you will see the whitish tendon of the muscle, which is called obturator internus muscle. And under this whitish tendon of the obturator internus, you can see the gemellus or gemellus inferior muscle. And finally is this muscle, which is called quadriceps, quadratus femoris, this muscle. Concerning of details of each muscle, I am going to show you one by one. All these pelvic trochanteric muscles that we mentioned, they have a general function as a main function that they are external rotators at the hip joint, and most of them also they have some function of the abduction. For better understanding, they have the external rotation at the hip joint when the lower limb is in the extended position, and they have abduction or abductors, they are or abduction function when the lower limb in the flexed position. The first muscle that is very important muscle, and also if you remember we discussed it at the joint section, it's the piriformis muscle. The piriformis muscle is starting from the pelvic surface of the sacrum or anterior surface of the sacrum, and is inserted to the greater trochanter of the femur. So this is the piriformis, and if you remember, this piriformis muscle is dividing the greater sciatic foramen to two parts. One foramen which is above, which is called suprapiriformis foramen or suprapiriform foramen, and the other was infrapiriform foramen or infrapiriformis foramen. Very quickly, for the revision, for the at the suprapiriform foramen, it passed the superior gluteal nerve, artery, and vein. At the inferior or infrapiriformis foramen or infrapiriform foramen, it passed the largest nerve of your body, which is seen here very nice, is the sciatic nerve, together with the inferior gluteal nerve, artery, vein, and posterior cutaneous nerve of the thigh, plus the pudendal nerve and the internal pudendal artery and vein. That here is another structure that you can see, which is the inferior gluteal artery here. This is the piriformis. We talked about the function for all this pelvic trochanteric. The main function is the external rotation at the extended lower limb at the hip joint, and abduction when the lower limb is in the flected position. Next muscle that you can see it here is the gemellus or gemellus superior. Gemellus superior is originated from the ischial spine and is inserted to the place which is called the trochanteric fossa. A little bit above the trochanteric fossa is the place for the insertion of the gemellus superior. The function is the same, and at the end I will tell you the innervation for the all muscles, which are all also the same for all the muscles. Here is the tendon of the obturator internus muscle. The obturator internus muscle is starting from the internal surface of the the obturator membrane, and is inserted to the trochanteric fossa, again a little bit above that. This is the tendon of the obturator internus, and under the obturator internus here you have the gemellus inferior or gemellus inferior muscle. Again, this muscle is originated from the superior part of the ischial tuberosity or ischial tubercle, and inserted again to the above the trochanteric fossa. The last muscle that very nice it's seen here is the quadratus femoris. Be careful, don't do mistake with the quadriceps femoris, which contain of forehead and is at the anterior compartment of the muscles of the thigh. Here is called quadratus according to its shape, quadratus femoris, and this quadratus femoris is starting or originated from the ischial tuberosity. It means the internal surface of the external surface of the ischial tuberosity, and also is inserted to the intertrochanteric crest of the femur, and the function is the external rotation at the hip joint. All these muscles again that I repeated, so the piriformis, gemellus superior, obturator internus that you can see the whitish color, the tendon, gemellus inferior, and quadratus femoris muscle. They are the pelvic trochanteric muscle that all of them they are innervated directly from the nerves that they are arising from the sacral plexus. So here we have the muscle that I already mentioned. It's the tensor fasciae latae. Tensor fasciae latae is the muscle which is originated from the anterior superior iliac spine and the part of the iliac crest, and is continue to this thick dense connective tissue which is called iliotibial tract or tractus iliotibialis. You can see here this iliotibial tract is the lateral continuation of the fascia which is called fascia lata femoris, which is covering the femoral region, and when it's coming laterally is becoming very thick as a iliotibial tract. This iliotibial tract then finally, as you see, is inserted to the lateral condyle of the tibia or at the lateral side of the tibial tuberosity here. The tensor fasciae latae, it has a function as an auxiliary function as a flexion, abduction, and internal rotation of the hip joint. Be careful, the other muscle that we already mentioned, they were extensors. Here is the auxiliary function as a flexors and abduction and the internal rotation. And thanks to this tibial tract, which is inserted downward and distally to the lateral condyle of the tibia on the lateral side of the tibial tuberosity. It's keeping the extension of the lower limb at the knee joint. This is another function that it has. This muscle is innervated by the superior gluteal nerve, the same innervation that the gluteus medius and gluteus minimus they have it. Since I have this preparation, again I will revise with you the muscles of the posterior compartment of the hip joint. As you see here, you can see the superficial layer. The superficial layer are contained of those gluteal muscle plus, as you see, the tensor fasciae latae. So this is the gluteus maximus, that already we discussed. And if I open it and dip to the gluteus maximus, I will fix it here. We see the gluteus medius here, the gluteus medius, which is cutted here, as you see. And if I open the gluteus medius, and again I will fix it here, then you can see the gluteus minimus, which is under the gluteus medius. This is the gluteus medius. Once more, gluteus maximus, gluteus medius, and gluteus minimus. Then we have the pelvic trochanteric muscle, very nice. You can see the piriformis muscle. The piriformis muscle, which above and below it was suprapiriform foramen, which passing the superior gluteal nerve, artery and vein. And the infrapiriformis, which is very nice, you can see the largest or thickest nerve of the body. This is the sciatic nerve, and the other structure that we already mentioned. And finally, under that, we have gemellus superior. Then you can see this whitish tendon of the obturator internus muscle. And under that is gemellus or gemellus inferior. So the key for finding of the gemellus superior and inferior between, it's the whitish tendon of the obturator internus. So above that is gemellus or gemellus superior, and below is the gemellus inferior. And finally, very nice muscle here that it's called quadratus femoris. Quadratus femoris. So once more, quadratus femoris, gemellus inferior, the whitish tendon of the obturator internus, gemellus superior, and piriformis muscle. Here there are the muscles of the anterior compartment of the thigh or femoral region. We have two main muscles at this region. First muscle is sartorius. This is the sartorius muscle. Sartorius muscle is starting, as you see very nice here, originated from the anterior superior iliac spine, and is inserted to the special place that I'm going to talk about. That is called pes anserinus major. It's the place that is inserted finally to the medial condyle of the tibia, medial to the tibial tuberosity, and is the place for the insertion of the three muscle. One of this muscle is sartorius, and the other muscle that I'm going to talk about this in a while. So this is the sartorius muscle. We said the origin and insertion. The function of the sartorius muscle is the flexion and abduction and external rotation at the hip joint. The function is at the hip joint and knee joint. So once more, the flexion, abduction, and the external rotation at the hip joint. And also we have the flexion and the internal rotation at the knee joint. This is the function. Innervation of this muscle is by femoral nerve. Next muscle at the anterior compartment is this big muscle, which is called quadriceps femoris. Quadriceps femoris, it means that it has 4 heads. The first head that you can see is this one, which is called rectus femoris. The rectus femoris is originated from the anterior inferior iliac spine, and it continues to the patella. We discussed it about this, and patella as a largest sesamoid bone is inside the tendon of this muscle, which is called rectus femoris. And then finally it's continue as a patellar ligament and is inserted to the tibial tuberosity. So this is the rectus femoris. Then we have this lateral head. It's called vastus lateralis. Vastus lateralis. Very nice. You can see here, since I have this iliotibial tract, that is continuation of the muscle tensor fasciae lata. So here is the tractus iliotibialis. Then you can again back to this muscle, the vastus lateralis, vastus intermedius, and vastus medialis. The vastus medialis is originated from the medial lip or the labium mediale of the linea aspera. The vastus lateralis is originated from the labium laterale or the lateral lip of the linea aspera, and the vastus intermedius is originated from the anterior surface of the femur. So all of them, they are inserted to the tibial tuberosity. So the function of this quadriceps femoris, the rectus femoris that you have it here, is a muscle that has a function at the hip joint and also the knee joint. The rectus femoris alone, it can cause, or it has a function which is flexion at the hip joint and extension at the knee joint. This is in 2 joints is working, but the other heads, it means that the vastus lateralis, intermedius, and medialis, they are making the extension at the knee joint. There are extensors at the knee joint, together with the rectus femoris. Rectus femoris, it additionally has another function, which is the flexion at the hip joint. All these muscles, they are innervated by femoral nerve, the same nerve that is innervating the sartorius. So here, because it's very nice preparation, again, I'm showing you a very nice inguinal ligament here. And under the inguinal ligament is muscular compartment, again the iliopsoas muscle together with the femoral nerve, and the vascular compartment that is the femoral vein and femoral artery, inguinal ligament. Here we are going to revise the muscles of the anterior compartment of the thigh in other preparation. Here is the sartorius, as you see, starting from anterior superior iliac spine. Here the sartorius is cutted, and for better view to the deep layer. So as you see, the sartorius is inserted to the pes anserinus major. If I remove the sartorius, another muscle is the quadriceps femoris, that it consists of forehead, the rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. This for head of the quadriceps femoris. Here there are the muscles of the posterior compartment of the thigh or femoral region. There are three main muscles that they are called hamstring muscles. So the first muscle that is located medially and more superficially is this muscle, which is called semitendinosus muscle. Semitendinosus muscle is originated from the ischial tuberosity or tubercle here, and is inserted to the place that we already mentioned, and is called pes anserinus major, which is inserted to the medial condyle of the tibia, medial to the tibial tuberosity. Under the, this muscle, it has a function which is at the hip joint, is making the extension, internal rotation and adduction. And at the knee joint, it's making a flexion and internal rotation. Under the semitendinosus, you can recognize that it has a long tendon shape at the insertion and is inserted to the pes anserinus major. Under the semitendinosus, again on the medial side, you see another muscle which is called semimembranosus or semimembranosus muscle. You can recognize it that it has a thick membranous shape at the proximal part, and again is originated from the ischial tuberosity and is inserted to the medial condyle of the tibia. And if you remember from the joint, we said that is continuing as a ligament at the posterior part of the articular capsule of the knee joint, which is called an oblique popliteal ligament, and it's located in the posterior side of the articular capsule. This semimembranous muscle also at the hip joint is making extension, adduction and internal rotation, and at the knee joint is making a flexion and internal rotation. So these two muscles, they are located medially at the posterior compartment. Then the next muscle that here I have and is located more laterally, it's this muscle that it has two heads, and that's why it's called biceps femoris. Biceps femoris has two heads. This head that you can see, it's more located medially. It's the long head, and the other head is the short head of the biceps femoris. The long head of the biceps femoris, again, like other muscles, the semimembranosus and semitendinosus, is originated from the ischial tuberosity, and the caput brevis is originated from the middle or mid part of the middle third part of the labium laterale or the lateral lip of the linea aspera, and both of them, they are joining together and they are inserted at the head of the fibula. Usually we don't consider the short head of the biceps femoris as a hamstring muscle. So hamstring muscle, we usually consider the semi or semitendinosus and semi or semimembranosus and the long head of the biceps femoris together with the part of this muscle which is called adductor magnus, the hamstring part, or the part that is originated from the ischial tuberosity. So all these hamstring muscle, they have the common origin, which is called the ischial tuberosity, except this short head of the biceps, which is not considered as a hamstring muscle. The function of the biceps femoris, the long head, which is caput longum, is making the adduction and the external rotation at the hip joint, and both heads together, they are working as a flexion and external rotation at the knee joint. The innervation of all this muscle that I mentioned, it's the semitendinosus and the semimembranosus, both head of the long head, the both head of the biceps femoris are innervated by very thick nerve, which is here is the sciatic nerve that is later is divided to the common peroneal or common fibular nerve and tibial nerve that we are going to discuss. Another interesting information also, whenever you want to dissect the ischial nerve, always the ischial nerve is passing between the two heads of the biceps femoris, the long head and short head, and if you dissect them between them, it's passing the sciatic nerve that it's later is divided that to two branches that I mentioned. Here we are going to revise the muscles of the posterior compartment of the thigh in another preparation. Here you can see very nice at the medial side and more superficially the semitendinosus muscle, which is recognized, you can recognize it with the long tendon and insertion to the pes anserinus major. Under that it's the semimembranosus, which is here. You can see very thick membranous part at the proximal part, and these two muscles, they are medially, and more laterally this muscle is biceps femoris, and biceps femoris has a long head or caput longum and short head or caput brevis, and always, as we said, that between them definitely you will find the sciatic nerve. And here is very nice dissected. If I turn it, the nerve, and I find this sciatic nerve here, you see that the sciatic nerve in the various distance, it can be more proximally or can more distally, always is divided to these two nerve. This nerve that is continue the same axis, and it goes to this region which is called popliteal fossa, is called tibial nerve, and the other nerve that is separating from the sciatic nerve and it goes more laterally toward the head of the fibula is called common peroneal or common fibular nerve. That further is divided to the superficial and deep fibular or peroneal nerve. Both terminology is correct. So very nice, you can see the sciatic nerve, tibial nerve continue straight away to the popliteal fossa, and the common peroneal nerve that it's going laterally toward the head of the fibula and is divided to the deep and superficial peroneal nerve. Here we have the muscles of the medial compartment of the thigh or femoral region. They are called adductor groups according to the adductor group according to the function, because the main function of those muscles is adduction. First muscle that I'm going to discuss is this muscle. This is called gracilis muscle. The gracilis muscle is originated from the inferior ramus of the pubic bone here, and also from the medial part or medially from the origin of the adductor magnus, which is here, that in a while I'm going to talk. So here is the origin, and insertion of this muscle is the same insertion that the sartorius and semitendinosus, they have the insertion which was called the pes anserinus major, so which is inserted to the medial condyle of the tibia, medial to the tibial tuberosity. So this is the third muscle. So once more, the three muscles, they are inserted to the pes anserinus major, the sartorius, semitendinosus, and here now you have the gracilis muscle. The function of this gracilis muscle, as we mentioned, at the hip joint it's the adduction, and at the knee joint it's making a flexion and internal rotation. So this is the gracilis. Then we have a group of muscles that they are called adductors. So this is the largest muscle, which is called adductor magnus muscle, which is immediately it's located anterior to the semi-membranosus muscle, that it was the posterior compartment. We discussed it. So medial to that and anterior to that is this muscle, which is called adductor magnus. Adductor magnus has different origin. The main origin of the adductor magnus is the ramus of the inferior ramus of the pubic bone, then the ramus of the ischium, and the ischial tuberosity, the part that it was belonged to the hamstring muscle, or the same origin that they had it. So those are the origin of the adductor magnus muscle. The insertion of the adductor muscle, the part that were originated from the inferior ramus of the pubis and the ramus of the ischium or ischium, it's innervated to the medial lip of the linea aspera, and it's continue somehow horizontally and laterally or obliquely it's going, so it's called pars obliquum, or the oblique part of the muscle, which is inserted to the medial lip of the linea aspera. The part that is originated from the ischial tuberosity or ischial tubercle is inserted to the tuberculum adductorium or adductor tubercle, that it was above the medial condyle of the femur at the epicondyle part. So it's the part that is originated from the tuberous sciaticum. It's going and is inserted to the adductor tubercle. So the muscle, this muscle, it has, because it has different origin, so it has different function. The main function of both part, the pars oblique and the straight pars or pars rectus, they have the adduction at the hip joint and the auxiliary function as an extension or extension at the hip joint also. Especially the part that it's originated from the ischial tuberosity, and also it's making external rotation at the hip joint, the proximal part of the muscle. So we have some helping or the auxiliary function at the knee joint, which is making internal rotation at the knee joint, especially the distal part of the adductor magnus. Adductor magnus, it has interesting innervation. It's the muscle which is called diploneural muscle because it has double innervation, and because this muscle is the most posterior muscle in adductor groups, so it takes the innervation, the posterior part mainly by the ischial, the sciatic nerve, and also as a classic innervation of the adductor, also the other part, it's taking the innervation from the obturator nerve. So very interesting part of the adductor magnus, it's this part. If I open it, so the place of the insertion of the or distal part of the insertion of the adductor magnus, there is a place which is called hiatus or hiatus adductorius. Hiatus adductorius or hiatus tendinus adductorius is the place that, as you see very nice here, the femoral artery and femoral vein, they are going from the anterior side of the thigh, and they go to this hiatus adductorius, which is the place of the insertion of the tendon of the adductor magnus, and from here they are turning to the posterior part and they go to the popliteal fossa, and they are continue as a popliteal vessels, vein and nerve. So the place of the hiatus adductorius, it's the place that the femoral vessels from the anterior side, they are turning and they go to the posterior side. It means to the popliteal fossa, and the name is changing there to the popliteal vessels from the femoral vessels. Then the next muscle that I have it here is the adductor longus muscle. This is the adductor longus muscle that here is cutted. So the adductor longus muscle is originated from the pubic bone, approximately at the place that the tuberculum pubicum or pubic tubercle is located, and between the tuberculum pubicum or pubic tubercle and the symphysial surface or of the pubic bone. So in this place, approximately between them, it's the origin of the adductor longus muscle. So insertion of the adductor longus is the middle third of the medial lip of the linea aspera and the posterior part of the femur, and the function, the typical function is adduction, and also they do some flexion and external rotation at the hip joint. Very important, if I cut the adductor muscle, which is here, I did, and I remove the adductor longus here, very nice, you can see the other muscle, which is called here adductor brevis. Adductor brevis is originated from the inferior ramus of the pubic bone and is inserted to the superior 1/3 of the linea aspera, the medial lip, the labium medial or medial lip of the linea aspera. And of course, the function is adduction, the same, and flexion and external rotation at the hip joint. The next muscle that, those muscles, the adductor longus, which is here, and I remove it, under that is adductor brevis, which is here. Both of them, they are innervated typically by the obturator nerve, the obturator nerve that is innervating these two muscles. Next muscle, which is more anteriorly and is this muscle, is called pectineus muscle. The pectineus muscle is the important muscle which is originated from the pectent ossis pubis, or the pectent of the pubic bone, and inserted to the pectinal line or pectinate line at the femur, and it has a function as again the flexion, adduction, and external rotation at the hip joint. This muscle also is interesting and important because is the most anterior or ventral muscle of this adductor group. So it has a double innervation. So this is another diploneural muscles that it has two innervation. One innervation from the same nerve that is innervating the anterior compartment, it means the femoral nerve, and another innervation it's getting from the obturator nerve that is typically innervating these adductors. So the other muscle, another muscle which is not seen here, and we have to remove all this muscle here, and to find it, it's the obturator externus muscle that it's classified usually to this group of the adductors or medial compartment. The external musculus obturatorius externus is starting or originated from the outer surface of the obturator membrane and is inserted to the trochanteric fossa, and it has the same function. It means that external rotation and adduction usually for the hip joint, at the hip joint. So the typical innervation of this, the obturator externus, is the obturator nerve. Be careful, do not mistake with the innervation of the obturator internus that it was considered as a pelvic-trochanteric muscle in the deep layer of the posterior compartment of the muscles of the hip joint, which was innervated by the directly from the sacral plexus, but obturator externus is innervated by the obturator nerve. The last things that here I can show you, since I have it. So here, if I cut the pectineus muscle, under the pectineus muscle you can see the nerves, artery and vein, and those are usually the obturator nerve, artery, and vein, which is located here deep to the pectineus muscle. And then this obturator nerve is divided to the two branches, the superficial and deep branches, which is seen here. Revision of the adductor group or medial compartment of the muscles of the thigh. Here you have the gracilis, which is inserted to the pes anserinus major. Then the most posterior compartment here, which is immediately above or anterior to the semimembranosus. So here you can see very nice the semimembranosus. So above that immediately you have the adductor magnus. Here is this muscle, adductor magnus. And you can here very nice see the hiatus adductorius. Here the place that the femoral vessels is continue backside, backward to the and continue as a popliteal. Then the next muscle here is adductor longus muscle. And after the adductor longus, deep to the adductor longus is this muscle, which is the adductor brevis. And the most anterior muscle, which is here, is called pectineus muscle. And finally, we have the obturator externus that is not seen here. In this preparation, I would like to show you the pes anserinus major, which is the place for the insertion of the three muscles from each compartment. This is the semitendinosus muscle, which is one of the muscle at the posterior compartment. This is the tendon of the gracilis muscle, which is the muscle from the medial compartment or adductor compartment of the thigh. And this is the tendon of the sartorius muscle, which is the muscle from the anterior compartment of the thigh or femoral region. So all these three muscles, they have the common insertion, which is called pes anserinus major, which is finally is inserted to the medial condyle of the tibia or distally extended medially from the tibial tuberosity. So once more, semitendinosus, gracilis, sartorius, and the name of the pes anserinus major is arising that it looks like a foot of the seabird. It's like this. We continue about the muscles of the anterior compartment of the leg or crural region. Those muscles, they are generally have a function as a extension. It means that they are extensors of the foot. There are three muscles in this group. The first muscle that it's located laterally from the tibia. You see that here is the tibia, the anterior margin of the tibia, and in lateral side is the first muscle is called tibialis anterior muscle. Tibialis anterior is originated from the lateral surface of the tibia, as we mentioned it here. Is starting from the interosseous membrane and is originated partly from the fascia of the located in the at the crural region. The insertion of this muscle is this tendon, which is inserted to the medial cuneiform bone and is inserted at the base of the first metatarsal bone. So once more, the origin is from the lateral surface of the tibia and interosseous membrane, insertion to the cuneiform, the medial cuneiform bone, and the base of the first metatarsal bone. The function is dorsal flexion of the foot or extension of the foot and supination of the foot. It means that when you are standing on your heel, this is the function of the tibialis anterior. Next muscle, which is located here, is this muscle. This muscle is called extensor hallucis longus. Extensor hallucis longus is originated from the lower half of the fibula and the interosseous membrane, and distally the insertion, it goes to the distal phalanx of the toes. It means that the first finger or toes or hallucis finger. So this is the tendon. You can see it goes, the only muscle or the tendon that it goes to the toes. So it's called extensor hallucis longus, and of course the function according to its name is the dorsal flexion of the foot and the extension of the toes. The next muscle that here I have it. So here is the extensor digitorum longus. Extensor digitorum longus is originated from the lateral condyle of the tibia and interosseous membrane, and then also some part of the fibula, and inserted to the dorsal aponeurosis of the second till fifth finger, like this. As you see, you can see the tendon of the extensor digitorum longus, and at the base of the fifth metatarsal bone, also it can be a variation which is called proneus tertius or proneus or fibularis tertius, which is the part of the extensor digitorum longus which is inserted to the base of the fifth metatarsal bone. The function of this muscle is the dorsal flexion or extension at the foot, and pronation of the foot, and the extension of the second till fifth finger. All those muscles, they are innervated by the deep fibular or deep peroneal nerve. Where you can find the deep fibular or peroneal nerve, here again is tibialis anterior. Here is the extensor hallucis longus, and if you open between them, you can see one large vessel which is called the anterior tibial artery, and the vein accompany, and together with that one, it's passing the deep or fibular or deep peroneal nerve that is responsible for the innervation of the anterior compartment of the leg. The anterior tibialis vessels, they are going to the foot region, to the dorsal or dorsum of the foot, or the dorsal surface of the foot, and from the level of the ankle, it means the lateral and medial malleolus, it continues as an artery of the dorsum of the foot, or artery of the dorsum pedis, and here also you can palpate the pulse of the arteria dorsalis pedis, or artery of the dorsum of the foot, very nice, and it has a clinical importance for this artery. The deep peroneal nerve that is innervating this anterior compartment, then it's arising at the fissure between the first finger and second finger. It's coming out as a sensitive innervation and is innervating this area that we will discuss it at the nervous system section. Here we have the muscles of the lateral or fibular compartment of the leg or crural region. There are two muscles. One muscle which is here more superficially is called the musculus peroneus longus or fibularis longus, and the other which is under that, it's the musculus peroneus brevis or fibularis brevis. Musculus peroneus longus is originated from the head of the fibula and also originated from the proximal half of the lateral surface of the fibula, and is inserted, as you see, behind the lateral malleolus or the lateral ankle. It's going to the plantar side and is inserted to the plantar side of the medial cuneiform and the base of the first metatarsal bone. The function of this muscle, according to its name, is pronation and plantar flexion and abduction of the foot. These are the main function that this muscle has. This muscle is innervated by the superficial peroneal or superficial fibular nerve. The next muscle, which is right away behind of this muscle, you can see here, it's the peroneus brevis, musculus peroneus brevis or fibularis brevis, is starting or originated from the distal half of the lateral surface of the fibula and is inserted here, again the same, under the behind the lateral malleolus or lateral ankle, but this time is inserted to the tuberosities of the fifth metatarsal bone. If you remember, at the base of the fifth metatarsal bone, we have the tuberosity of the metatarsus quinti, and here is the place for the insertion of the musculus fibularis brevis. The function, again the same, is pronation, plantar flexion and abduction of the foot, and the innervation also is the same, the superficial fibular nerve superficial peroneal nerve. Here again it's very important for dissection, if you want to dissect the structure, which is called retromalleolar region. It's the lateral retromalleolar region. At the lateral retromalleolar region, you can see the tendon of the flexor, the peroneus longus or fibularis longus, and peroneus brevis or fibularis brevis. And again, more posteriorly, you can find two structures. One, a structure which is a superficial vein of the lower limb is going dorsally together with the cutaneous nerve, or which is a sensitive nerve for innervation of the skin. This vein is called the small saphenous vein or vena saphena parva, and the nerve is called sural nerve, that they have accompanied with each other by each other. They are have the common pathway, and if you continue and if you go proximally, you see that the small saphenous vein is open to the this vein, which is here, and is called popliteal vein. If you remember, the popliteal vein and artery, they are continuation of the femoral vein and artery from the adductor hiatus at the insertion of the adductor magnus muscle. From the anterior side, it's turning and it goes to the popliteal fossa, which is this area, and they are changing the name as a popliteal vein and popliteal artery. And these two vessels accompany or together with this nerve, which is the tibial nerve. It's the content of the popliteal fossa, and the more superficial structure is the nerve, and then it's the vein, the popliteal vein, and the most deep or the deepest structure is the popliteal artery. The sural nerve that I already mentioned it here, there's a sensitive nerve. It's giving or getting origin from one side from the tibial nerve and one side from the common peroneal or common fibular nerve. Muscles of the posterior compartment of the leg or crural region. We divide those muscles to two layers, the superficial layer and deep layer. The muscles of the superficial layer are one muscle which contain or consist of three heads, whole muscle is called triceps surae. Triceps surae is composed of 3 heads. This head that we cut it is called gastrocnemius lateralis, or lateral gastrocnemius, which is originated from the lateral condyle of the lateral epicondyle of the femur. And this muscle also, which is cutted, is the gastrocnemius medialis, or medial gastrocnemius, which is originated from the medial epicondyle of the femur. And also, if we remove that, so you can see this muscle, which is called soleus muscle, which is originated from the head of the fibula. And if you remember here, we have the soleal line, or linea musculi solei, which is origin for the soleus muscle. All these 3 muscles, they have a common tendon, which is a very famous tendon, which is called Achilles tendon, or tendocalcaneus, and is inserted at the calcaneal tubercle at the back of the calcaneus and the posterior part. And this is the thickest and strongest tendon of your body, and this is a common tendon for the gastrocnemius medialis, lateralis, and soleus muscle. This muscle, it has a function because it's inserted to the backside of the, or posterior part, or the tuber calcaneae, or posterior part of the calcaneus. This muscle generally has a function as a plantar flexion of the foot, and only the gastrocnemius lateralis and gastrocnemius medialis, they have a function at the knee joint, which is making a flexion at the knee joint. The soleus muscle, it doesn't have any effect at the knee joint. Soleus muscle is just making a plantar flexion. Is very interesting concerning this muscle is that here the place of the origin of the soleus muscle, which is the arch shape, this connection of the origin with the bony part of the linea musculi solei, or the soleal line, it's arch-shaped tendon, which is called arcus tendinus musculi solei, or tendinal arch of the soleus muscle. And through this tendinal arch, as you see here, that my pin said it goes, it passes the tibial nerve accompanied with the posterior tibial vessels. So this is the structure that they pass through the tendinal arch of the soleus muscle at the origin part of this muscle. Innervation of this muscle is innervated by, of course, the tibial nerve. Another muscle that we have it in this region is this small muscle, is a rudimentary muscle. It can be missing in some people, or sometimes it can be upside down. Also, it's happening that when we are dissecting, we see. This is called the plantaris muscle. The plantaris muscle is starting from the fascia at the popliteal region, or the line which is called the lateral supracondylar line, and the insertion. This is the narrow muscle, and it has very long tendon, which is this tendon also is fusing with the Achilles tendon, or tendocalcaneus, and in this case it's inserting to the tuber calcaneae, or calcaneal tubercle at the posterior side, and function is the same. It has a very weak plantar flexion of the foot, and very weak flexion also at the knee joint. Revision of the muscles of the superficial layer of the posterior compartment of the crural region, or the leg region. So we had 2 muscles. One muscle which is called triceps surae, which composed of 3 heads. This is the gastrocnemius, the lateral gastrocnemius or gastrocnemius lateralis. This is the medial gastrocnemius, which is cutted, and then when I open it under that, it's the musculus soleus or soleus muscle, and this is the plantaris muscle. As you see, it's very small, narrow muscle with a very long tendon, which is fusing to the tendon of the triceps surae together as a Achillus tendon or tendocalcanus, which is inserted to the tuber calcane or calcaneal tubercle. Back to this region, we said that at the origin of the soleus muscle, the tendon, which is connecting this muscle to the bone, so it's making an arch shape, which is called arcus tendinous musculi solei, or the tendinal arch of the musculi solei, and through this arch it passed this nerve, which is called the tibial nerve, and the vessels, which are called posterior tibial vessels, which are posterior tibial artery and posterior tibial vein. Here we are continuing with the muscles of the deep layer of the posterior compartment of the crural region or leg. The best way to find those group of muscles is the formula that in a while I'm going to tell you. First, you have to find the medial malleolus or medial ankle of the foot. Posterior to that, you will see some structure as seen here. The first structure, which is right away behind the medial malleolus or posterior to the medial ankle, is this tendon. This tendon, if you continue, it's the tendon of the tibialis posterior muscle. Tibialis posterior muscle. The tibialis posterior muscle is originated from the interosseous membrane and the posterior surface of the fibula and tibia, and the insertion of this muscle is the tuberosity of the navicular bone and the plantar surface of the cuneiform bone and the cuboid bone and the base of the second, third, and fourth metatarsal bones. The function is, as a matter of fact, is the plantar flexion of the foot and supination of the foot, and this is the main function and is innervated by the tibial nerve. This is the first muscle. The second muscle that you have it here behind the tibialis posterior is this muscle, which is called musculus flexor digitorum longus. This muscle is originated from the medial part of the posterior surface of the tibia and is inserted to the plantar surface of the phalanges, the distal phalanges of the second, third, and fifth finger. The function, again, according to the pathway of this tendon, is the plantar flexion of the fingers and foot, and the innervation of this muscle is by the tibial nerve. Then the few structures that you can see here, there are vessels and nerve. It means that first we have vein, it's posterior tibial vein, which are usually 2. The second structure is posterior tibial artery, and finally the last or the posterior structure is the tibial nerve. Here we have the posterior tibial artery, vein and artery and nerve that when they go and they reach to the plantar region, they are dividing to the branch as a medial plantar and lateral plantar vessels and nerve. And finally, the last structure that is seen here is this muscle, which is better, you can see it here, is here. It's the flexor hallucis longus muscle. Flexor hallucis longus muscle is originated from the distal two-thirds of the posterior surface of the fibula and the interosseous membrane, and is inserted to the plantar surface of the distal phalanx of the toes or hallucis. The function is the flexion of the toes and the plantar flexion of the foot, which is also this muscle is innervated by tibial nerve. So the formula that I said it that to remember to learn this group of the muscle is that always find the medial malleolus or medial ankle of the foot. So at the retromalleolar region, the medial retromalleolar region, you have tibialis posterior muscle, flexor digitorum longus, vein, artery, nerve. Vein and artery is the posterior tibial, the nerve is tibial nerve, and finally it's the flexor hallucis longus. It means TD1H or TD1H. Tibialis posterior, flexor digitorum longus. One is for posterior tibial vein, which are usually two. Then is posterior tibial artery, A, on. N is for the tibial nerve. And H or H is the flexor hallucis longus, TD1H or TD1H. This is the retromalleolar region that you can recognize all the muscles. In this group, the deep muscle or the deep layer of the muscles of the back, at the proximal part we have additional muscle which is called Popliteus muscle, the Popliteus muscle that in a while I'm going to show you. Regarding the deep layer, the muscles of the deep layer of the posterior compartment of the leg, we have at the proximal part we have one muscle which is here, you can see, is called Popliteus muscle. This Popliteus muscle is originated from the lateral epicondyle of the femur and is inserted to the posterior surface of the proximal part of the tibia. As you see, it's approximately above the line, for soleal line, or the linea musculi solei, if you see here. So above it is inserted. The function of this muscle, its auxiliary function, it's the flexion at the knee joint, and when is the flexed leg at the knee joint, it can have some internal rotation at the knee joint, and also it's influencing for the movement of the lateral menisc. So here is one of the muscle which is making the floor for the popliteal fossa and is innervated by the tibial nerve. So this is the Popliteus muscle. Concerning the muscles of the foot, the preparation of the muscles of the foot is very difficult. So I just tell you some short information about the muscles of the foot, because we don't have all these muscles dissected. At the dorsum of the foot, the muscles of the foot, we divide them, the muscles at the dorsum of the foot or the dorsal surface of the foot and the plantar surface of the foot. For the dorsal surface of the foot or dorsum pedis, we have two muscles. We have this muscle that you can see it here under the tendon of the flexor, the extensor digitorum longus. We have another muscle which is called extensor. Here you can see extensor digitorum brevis, and the tendon is here, you can see, and under the tendon of the extensor hallucis longus also we have another muscle which is the extensor hallucis brevis. So two muscle, extensor digitorum brevis and extensor hallucis brevis, they are the two muscles of the dorsum of the foot. Both of them, they have innervation from the deep fibular or deep peroneal nerve, and according to their name, the function is the extension. The extensor digitorum brevis is the extension of the second, third, and fourth finger, and the extensor hallucis brevis is the extension of the toes. Regarding the muscles of the plantar region of the foot, we divide them to three main groups: the muscle of the toes or hallucis, the muscles of the small finger, and the muscles that they are between them in the midline region. The muscles of the toes, as I mentioned here, the dissection of the muscles is very difficult, so I just mentioned the name of the muscle. The muscles of the toes, there are three muscles. One is musculus abductor hallucis. This is the most superficial and the most medial part of the muscle. Then under that is the flexor hallucis brevis, that it has two heads, and the caput medial or medial head and lateral head. And finally, the most lateral part or lateral muscle that in this group is the adductor hallucis. Adductor hallucis is the muscle that it has two head, oblique head and transverse head. All these muscles of the toes, it means that the abductor flexor hallucis, flexor hallucis brevis, and the adductor hallucis, they are innervated by the medial plantar nerve, except the adductor hallucis, the both head, the oblique and transverse head, it's innervated or are innervated by lateral plantar nerve. The muscles of the small finger, we have two muscles, the abductor digiti minimi pedis and the flexor digiti minimi brevis for the foot. And according to their name, we have the function, and both of them, they are innervated by the lateral plantar nerve. We have in some literature, you can see the opponens digiti minimi muscle also, that also in some literature is mentioned and also is innervated by the lateral plantar nerve. And concerning the muscles of the midline, we have the muscle that here, one of them it's seen here. So as I mentioned it, if you have the plantar region and you are going to dissect, the first you remove the skin, and under that is the subcutaneous connective tissue, and after that is the plantar aponeurosis, that if you remove it, then you will reach to this muscle, which is called the musculus flexor digitorum brevis. This muscle is making the flexion at the middle phalanx of the second, third, fourth, and fifth finger, and is innervated by the medial plantar nerve. Then under that, if I open it, you will see the tendon of the flexor digitorum longus muscle, and the posterior of this tendon, you have this muscle here. Part of this muscle is very well seen, and this muscle is called musculus quadratus plantae. This is starting from the plantar surface of the calcaneus and is inserted to the lateral margin of the tendon of the flexor digitorum longus, and the function is making a flexion of the finger, and is innervated by the lateral plantar nerve, this branch of the tibial nerve. Then, of course, like muscle that we had it in the hand region. We have interosseous muscle, of course the dorsal interosseous muscle, which are 4, and their function is the abduction of the finger according to the axis of the, be careful, according to the axis of the second finger. In the hand we had according to the axis of the third finger, but in the foot we have that according to the axis of the second finger. So there is an abduction of the finger according to this axis, and is innervated by the lateral plantar nerve. We have the interosseous plantaris muscle or plantar interosseous muscle, that there are 3, and they are located in the medial margin of the 3rd, 4th, and 5th metatarsal bone, and they are doing the adduction of the finger according to the axis of the second finger. Finally, we have like a hand, we have the lumbrical muscles, that there are 4 muscles, and they are locating starting or originated from the tendon of the flexor digitorum longus, and is inserted to the dorsal aponeurosis of the 2nd, 3rd, 4th, and 5th finger. And the function is the same that we had it in the hand, but which is the flexion of the metatarsophalangeal joint and the extension of the interphalangeal joint at the 2nd till 5th finger. And also there are some adduction movement. The innervation of these lumbrical muscles also is a diploneural muscle. It has a double innervation. For the 1st and 2nd finger, they are innervated by the medial plantar nerve, and for the 4th and 5th, for the 3rd and 4th finger is, or the 3rd and 4th lumbrical muscle, which are located laterally, is innervated by the lateral plantar nerve. Regarding the superficial veins of the lower limb, as we mentioned it in the upper limb, that we have 2 main superficial vein, as a cephalic vein and basilic vein. Here also in the at the lower limb also we have 2 superficial veins. One vein that already I discussed it, and it was a small saphenous vein, and or vena saphena parva, that it was passing together with the sural nerve, and it was opening to the popliteal vein, already is discussed, and at the posterior, the muscles of the posterior compartment of the leg. And here we have another superficial vein of the lower limb, which is called the greater saphenous vein. The greater saphenous vein, it's coming from the region of the medial ankle of the foot, at the medial aspect of the thigh, is coming proximally, and here, as you see, very nice, that is draining to the femoral vein at the hiatus of the greater saphenous vein. And this vein also is accompanied with the superficial vein cutaneous nerve, that is innervating the sensitive innervation of the skin of the lower limb, that we will discuss it later, and it's a branch of the femoral nerve, is called a saphenous nerve. So greater saphenous vein, it's going accompanied with accompanied by the saphenous nerve, and the greater saphenous vein is draining to the femoral vein at the proximal part of the thigh region, and at the anteromedial aspect of the thigh, which is here. Here is the greater saphenous vein, and here is the femoral vein. Dear student, that's all about the muscles of the lower limb and the general information concerning the nerves of the the main nerves of the lower limb and the main vessels of the lower limb, absolutely general information. At the end, I would like to thank Dr. Petrashek for his assistancy, and also I would like to thank you for your attention, and I wish you have a nice day, and stay safe and study hard. Thank you.